Hey everyone, and welcome. Today we're going to talk about something that really touches every single community, especially right here in Arkansas. We're talking about National Prevention Month. We'll break down what it is and why it's more important right now than maybe ever before.
You know, when you think of October, what comes to mind? Probably cooler weather, the leaves changing, maybe some football on the weekends. But this month actually holds a much deeper meaning for the health and the future of our communities.
So yeah, that brings us to our first big question. Why does this all matter so much right now? We're going to connect the dots between the season and this really vital national observance. Okay, so October is officially National Prevention Month. It actually started all the way back in 2011, and they intentionally timed it to line up with the start of the school year, which makes a ton of sense, right? The goal then, and the goal now, is to get young people and their families talking early about preventing substance misuse and, just as important, building strong, healthy communities from the ground up.
Now let's bring this story home, right here to Arkansas. Because when we look at the data, it tells, well, it's kind of a tale of two very different statistics. It's a story of some incredible progress, but also a story of a really serious, ongoing challenge.
First, let's talk about the good news, and it is really good news. Check this out. Arkansas saw a remarkable 26% drop in overdose deaths in just the last year. That is huge. It really shows the hard work of so many people in things like getting the Loxone out there and boosting community education. It's proof that what we're doing together is making a real, life-saving difference.
But, and this is a big but, here's the other side of that story. At the very same time, Arkansas has the highest opioid prescribing rate in the entire nation. We're talking 71.5 prescriptions for every 100 people. That is the stark contrast we're facing. Even as we're getting better at saving lives from overdose, the conditions that can lead to misuse in the first place, they're still incredibly high. And you know, the challenge isn't just limited to opioids. If we look at our kids, this chart shows that almost 9% of Arkansans aged 12 to 17 had a substance use disorder last year. That's a serious number. It's a really clear reminder that our prevention efforts have to be ongoing, and they absolutely have to start early.
So all this talk about prevention really begs the question, what do we actually mean by that? It's a word we hear all the time, so let's just break down what real, effective prevention truly looks like.
The most crucial word here is proactive. See, prevention isn't about waiting for a problem to pop up and then reacting to it. It's all about getting ahead of the curve. It's about reducing the things that put people at risk and, just as importantly, building up the things that protect them, like strong support systems and healthy ways to cope with stress.
And you gotta know, prevention isn't a one-size-fits-all kind of deal. There are actually 3 different levels. You've got primary prevention, which is all about stopping substance use before it even has a chance to start. Then there's secondary, which is about stepping in early for folks who might be at a higher risk. And finally, tertiary, which focuses on reducing harm and preventing relapse for people who are already in recovery. Every single level is absolutely essential.
And listen, effective prevention goes way beyond just telling kids to say no. It's about building an entire environment that actually supports healthy choices. We're talking about fostering strong connections with family and friends, making sure people can get mental health care when they need it, creating safe communities, and really getting at the root causes, things like trauma and poverty that can lead to substance misuse to begin with.
Okay, so that's the theory, right? That's the big idea. But how does all of this actually get put into practice on the ground, right here in Arkansas?
So let's dive into that. Let's look at the specific strategies being used right now to build a stronger, healthier state for all of us. Here in Arkansas's Region 4, prevention providers are really tackling this on multiple fronts. I mean, you've got school-based education and programs to get young people involved, but it's also about super practical things, like training programs for naloxone so people can respond to an overdose. And at the same time, they're helping out local community groups and running media campaigns to get the word out. It's a really comprehensive approach.
So we've covered the what and the why. But now we get to what I think is the most important part, your piece of the puzzle. How does all of this connect back to you? Well, a perfect opportunity to get involved is literally just around the corner. Red Ribbon Week kicks off on October 23rd, and it's the biggest and longest-running drug prevention campaign in the entire country. It's a time when millions of people stand together for a drug-free future.
And I love this year's theme. Life is a puzzle, solve it drug-free. It's such a great metaphor because it reminds us that every single person, every single choice we make is a vital piece in building that healthy, complete picture for ourselves and for our whole community.
You can be a part of it by taking the Red Ribbon Pledge. It's a really simple but really powerful commitment. It's got 3 main steps. First, just talk. Have those open, honest conversations. Second, support. Be there for people who need help. And third, lead. Set a positive example with your own choices. Seriously, anyone can do this.
And that's really where this all leads. Prevention isn't someone else's job. It's a community effort. It's an all-hands-on-deck situation where every single one of us can make a real difference. So I'll just leave you with this question to think about. What part of the solution will you be?